We see the advertisements all the time. Are you suffering from low T? But what does having low testosterone really mean? And is this just a concern for men? Well, here to fill us in on all the facts on testosterone and our hormones is Dr. Jenny. Did I say that right?
You said it correctly.
I have a hard time with saying testosterone.
No, you called it testosterone.
No,
That's a combination of estrogen and testosterone.
That's what I think I need.
But we always hear of it as something, you know, that makes you manly. But does it affect women as well?
Yeah.
Oh my gosh, women with low T, and the moment you give them that testosterone, remember the swinging off the chandeliers, just the energy that you get, and just the overall, you just feel good.
What does it do for men?
But for men, I mean, it just makes you super masculine, you know, when the guy just is very aggressive, come hither, you know, woman, get over here, get in my bedroom. That's, you know, you want a manly man. You want those pheromones and those juices flowing, right? You want a guy that's more aggressive, not just, you know, really timid.
But it's not just sex.
Yeah,
It's not just sex. It's all cognitive. It's mental function. So testosterone has been clinically shown to reverse Alzheimer's disease. It's linked to Alzheimer's disease and dementia. So that's a big, huge, you know, studies that they're doing on rats and showing how it's actually making the mind younger. So as you get older, those levels start to decline, your memory starts to diminish.
So that's
when you're forgetting your keys and you don't have no, you know, willpower to go do anything. You kind of become a, you know, a human slug. When you become lazy, I call it, you know, no testosterone equals a lazy human being, right?
Wow.
And no one wants laziness.
Oh, this is scary. You're not as smart, you're lazy. So what are
Now
the,
I know what I need
the
in my
warning
life.
signs?
Well,
this is scary. Tell us the warning signs.
Yeah,
First of all,
so-
the warning signs for men.
So men will experience low testosterone symptoms like low energy. So the moment a guy says, gosh, I just have no energy, or erectile dysfunction, when someone, you know, men do not want ED, okay? This is where Viagra starts to come in Cialis, and that's something that's bad for you. You don't want to take the Viagra, the Cialis, all these toxic chemicals, so testosterone is the natural Viagra. And then the memory loss, of course, we just discussed that. The weight gain, you see the men with big pot bellies, they look like they're 6 months pregnant and they never give birth. And then the hair loss, actually, you know, testosterone will equal, you know, balding. Male balding comes from low testosterone.
That's interesting. I always
So
thought
you
it was
give
the opposite.
increased testosterone. Nope, it's actually,
Really?
it's the DHT right before the testosterone that causes
interesting.
the hair, you know, to
So
bald.
if a man calls you baby all the time because he can't remember your name, low
Low
testosterone.
testosterone. Hey, baby. And then with women, you know, a lot of the symptoms are very similar too. Women will also experience the low energy, the disruptive sleep. So women are like, I just can't sleep. They wake up all the time in the middle of the night. Weight gain, it's not usually in the belly for women, it's in the hips. Hair loss for women, that's huge. A woman that's just losing her hair in the shower and she's got big balls of it. And then the osteoporosis, this is horrifying for women when your bones are thinning. No one wants to break their hip and you know, have a thinning bone. So you give a woman with osteoporosis or osteopenia a testosterone injection or a testosterone supplement in some form, their bone density increases and they feel better, they feel stronger. I call it my super weapon hormone because it helps me with my muscle tone and the trim. It just keeps everything, you know, the collagen in the skin. So it's an all-around awesome hormone, and it's easily tested for.
Okay, I know this sounds like a stupid question because I love the side effects because those seems like those are things I don't want. But on the other end, if I take testosterone, am I going to grow hair on my chest in random places?
And a mustache and a beard.
If you take too much, yes, that's absolutely a possibility. That's why testing for low T is very important. A lot of people just come in and they're not being supervised. So you always want to make sure that you're medically supervised and you're doing it as hormone replacement, not jack me up therapy.
How do you test for that? Is it a blood test or a saliva test?
Saliva test or a blood test. You can do both. You could even test it through urine. It's about $50 if you just do testosterone by itself. A majority of insurance companies will cover 100% of it, or you have a $25 copay, whatever your insurance network is. PPOs, HMOs, Medicare, TRICARE cover 100% of it. So it's super. I test my testosterone levels every single year, especially after I'm done having children. Bone density is low, hair's falling out, you have extra weight. The moment I check my testosterone levels, I pump myself back up. I do about a 2-month protocol for myself. I trim up, lean up, hair comes back fuller and thicker. If you look at pictures of me 2 years ago, my hair looked so limp and flat, and now it's just so luscious. Everyone's like, why is your hair so thick?
Boy,
It's like
something's working.
testosterone. Yeah, right?
Thank
And
you, Dr. Jenny.
Swinging off the chandeliers, right? The libido.
Nothing wrong with that.
It's working.
It's a combination of good
You
things.
can go
We
to
like
Dr.
testosterone
Jenny
by
at
Keys.
Main Street at her pharmacy, AgeVital. And you can go online and get information on this at AgeVital Pharmacy. So go to agevital.com and find out more. Next, we're going to see some Southeastern Guide dog puppies. A lot of Southeastern Guide dog puppies.
Aw.